Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah. Today we are going to talk about a very common topic known as diarrhea. Now I'm not talking about every cause of diarrhea, but diarrhea which is induced by rotavirus. So rotavirus is a virus which infects most of the time under the 5 years of age, but the most common attack happens within the first year of age. So how the rotavirus works? It really comes in the winter season and it infects the child like other infections like fecal root, and it goes and infect the intestine, which lead to massive watery diarrhea or loose stools. So it can be so extensive the child can go into the dehydration and sometimes into severe dehydration. So what are the signs for that? What we can look at the child is very irritable, crying excessively depending on how much dehydration he has. And if you check, they can have sunken eyes and they are not oriented and their skin is very lax and loose. So this incubation period is like I think 3 to 5 days and usually resolved within 2 weeks if it's taken care of properly so that child doesn't compromise his immunity. So what are the sign symptoms? Sign symptoms where with the excessive diarrhea, the child can have vomiting, they can have fever, they can have fatigue, and they are not able to keep anything into the stomach, and they can have very low appetite and very lethargy. So how do we test it? Usually this test is not needed, but if somebody want to do, then you can go for PCR from the from the stool. But most of the time, it's not try to like it's not investigated and usually is treated on empirical basis. So what about the treatment? Ideally, there should be no antibiotic for these babies, but in Pakistan, every kind of diarrhea, you have to take antibiotic for some reason. And more than that is that you have to hydrate the child. So ORS is the most important thing. So if you ask me what is the most important treatment for the baby or the child, it is ORS because this solution has the salts or the electrolytes which are wasted in the diarrhea and it can be replenished through ORS. But if the child is very dehydrated, we can have to admit the child and then we have to go the rehydration fluids. So what is the complication? It's very straightforward. Due to dehydration, you can have multiple problems. The infections can come in and wait. At the same time, child can have metabolic issues, and if it's neglected, and dehydration is not taken care of, it can lead into the death of the baby. And we here in Pakistan, the kids less than 5 years of age have very high mortality rate because we don't take care of the kids as they are supposed to be. What is the best way to prevent this? Number one is vaccine. We should get the baby's vaccine in time for rotavirus. Usually it's three episodes. I think it's like 2 months, 4 months, or 6 months, if I remember rightly. But rotavirus is the most common cause of diarrhea under 5 years of age, and sometimes it can be mortal. So, like many other infections we have talked in the past, rotavirus is also transferred through orophycal route. So if our hands are not clean and we don't eat the right food which is infected, it will end up in this problem. So always take care of hygiene. Hygiene of your perineal area, hygiene of your hands, and make sure that the food you eat is clean and fresh. Thank you very much.